Imagine being 16 years old and you find out you are bearing the life of a child when you are only a child yourself. So many questions buzzing around in your head. What will my parents say? Oh no, what will Matt do when he finds out? I just got my license, but I don't even have a car. I don't have a job. Our family can barely support ourselves now. I don't have a doctor. I've never even changed a diaper. My friends will think this is so weird. How am I going to finish high school? I want to go to college. Oh, geez. What do I do now? What a vulnerable time for your 16-year-old self. Not only are you so afraid you can barely move, but now you must act. You must make changes and plans for your child's future. The textbook Caring for the Vulnerable from 2016 explains that very young mothers are considered vulnerable due to lack of resources and poor prenatal care. Because of this, their rates of low birth weight infants and infant mortality are high. The article Promoting Health in Early Childhood proposes the statistic that persons who were born with a low birth weight were 25 to 44% less likely to pass English and math exams at age 16. Many factors affect infant mortality. Early prenatal care and education is of most importance. Proper diet is a part of the education provided to young mothers. According to the article Food Matters from the Journal of Applied Research on Children from 2016, pregnant adolescents experience high rates of food insecurity. Adolescents with food insecurity experience depressive symptoms, which predicted adverse birth outcomes. There are resources out there for assistance with the cost of prenatal care and proper nutrition, but a policy review by Harmeet Singh titled Stork Reality explained that these applications for these programs or grants can be 40 pages long and difficult to navigate. Even with free resources and great access to care, it can be difficult to reach pregnant women. Singh explains, in the District of Columbia, they have the most comprehensive infant mortality campaign in the country, yet they have the highest infant mortality rate, nearly 3 times the national rate. This brings about a whole new side of the issue that must be addressed: psychosocial cultural issues. The article Prenatal Care Initiation in Low-Income Hispanic Women from the American Journal of Health Behavior 2009 explained that those trying to assimilate into a new culture may have higher psychosocial risk factors such as higher distress, more stressful life events, and greater likelihood that the pregnancy was unintended. There are many programs sprouting up around the country that are attempting to assist pregnant teens and women in a holistic manner. These programs are bringing holistic prenatal care to their doorsteps, quite literally. The article The Mental Health Needs of Low-Income Pregnant Teens from 2014 explains the use of the Nurse-Family Partnership Program, where the nurse visits the pregnant teens at home and assists with a multitude of needs. The article explains that nurse home visiting is an evidence-supported intervention for mothers at risk that has been shown to have a positive short-term outcome for the mother and children. This program addresses high-risk behavior, tobacco, alcohol, and substance use during pregnancy, diet and nutrition, sexually transmitted infections, and prenatal medical care, along with PTSD and mental health. Other home visitation programs have shown that comprehensive and intensive nurse home visitation can reduce the risks of unfavorable outcomes associated with pregnancy among poor, unmarried women. Similar programs increase access to care, but do not quite bring them to their doorstep. Some programs have pop-up clinics at health centers, community centers, hospitals, and storefronts. Other programs have hosted sessions that expose teens to a wide variety of topics with many different modalities. Teens received feedback, affirmation, and social support from their peers and their health educator. Another program very pertinent to this vulnerable population is the Prenatal Care at School program outlined in the Journal of School Nursing from 2012. The program was created to decrease school absenteeism and poor compliance with prenatal care appointments. All of these programs showed increased mental health and knowledge and increased prenatal care, thus lowering low birth weight births. Although there are many types of programs, not all of them are available everywhere. It takes initiative from the community to put on such programs, and even when opportunities are flourishing, like in the District of Columbia, it can still be hard to find willing participants. Singh in Stork Reality spoke about how most European countries with lower infant mortality rates than the United States routinely pay bonuses if the mother obtains the recommended amount of prenatal care. What program do you think would have helped your 16-year-old self if you were the one with all those worries and questions? And then, what are you going to do to ensure that no 16-year-old girl has to shame herself or miss school or accidentally hurt the child she is bearing?